Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Good morning. Welcome back to the Mom with Moms podcast. We are continuing into 2025 our family healthcare series with Hackensack Meridian Children's Health. Our first guest of the year, Dr. Thomas Priolo. Welcome. Thank you for joining us.
Thank you.
Dr. Priolo is a board certified in psychiatry and neurology. It's cold out this morning. It was like a rough start to back to school. I feel like I was telling Edna over here, I'm like still frozen, so pardon me. You see patients at Hovnanian Children's Hospital at Jersey Shore University Medical Center, urgent care with behavioral health. You're also the Assistant Program Director, Child and Adolescent Psychiatry Fellowship, Hackensack Meridian School of Medicine. You're a psychiatrist trained in adolescent, child, and adult psychiatry, taking care of patients at Jersey Shore University Medical Center and Behavioral Health Urgent Care Center across the street from the hospital's Neptune campus. So welcome. Thank you for joining.
Thank you.
We're going to dive right in. I am so curious about so many things that you treat, how you're helping children in our community deal with depression, anxiety, ADHD. Right now, I think being a kid is, I will say, it seems heavier than when it was when we were growing up.
Yes.
The kids are, the internet just adds a different element, right? I was the first generation of kids that, the internet came to be when I guess we were in like 3rd or 4th grade, I want to say. We had like one computer in the house, right? And we all kind of fought over it. And it was mostly like who could, I had like a 17 magazine, like software system, right? Or whatever. But it was not what it was.
Yes.
Although, we look back at like the chat rooms and stuff they were in on AOL. So it wasn't, it was similar, but when you didn't bring things home the way that kids do now.
Exactly.
Kids have phones and there's a lot to it. I think that parents in general are starting to really see the effects of kids having exposure to all kinds of different things, in school, out of school, and a lot of it, seems to be driven by social media. So I'm curious what you think about how that has affected children's maybe spike in anxiety and depression. Has it spiked? But tell me, what you treat and what your thoughts are and
Sure.
all of that.
So we can start with the social media aspect of it. I agree, it's way different than when we grew up.
Mm-hmm.
We didn't have any of these social media platforms. So a lot of the times what we're seeing now is where kids might have been bullied or bothered at school. Mm-hmm. When they got home from school, it was done with.
Yep.
They were able to hang out with who they wanted to see, their family. They were able to vent about things that happened at school. But now what we're seeing a lot is, there will be messages on Instagram or Facebook and groups on those social media platforms where the kids don't get away from those stressors. Outside of that, they're also constantly looking at what their friends have, and social media, you present the life that you want people to think that you have.
Right.
So these kids are seeing what they believe their friends have or the lives that their friends are living, and it definitely creates some psychosocial stressors for them. They want what they feel that the other people have, but when you look at the whole picture, they have things that their friends don't have, but they're not posting it. So it leads to kind of, a crack in their ego, I would say, a little bit.
Interesting.
The other aspect, I think, which is kind of lesser known, is these social media apps that are message based, so something like Discord, where there could be 500 kids in a group chat, and they're from all over the country. They form friendships on here. They don't see the face. They don't know the person. It's strictly a messaging and a video, a messaging and a audio app.
Okay.
So they're able to talk to one another and things. The problem with an app like that is what we see sometimes is they have different topics for each chat. So sometimes there'll be a chat where they form what they feel is a supportive environment for kids with anxiety. And it'll be a bunch of kids with anxiety constantly talking about what they're anxious about. And it's almost like a spiral
Perpetuates
downward.
it.
Exactly.
Yeah.
It even gets a little darker where there's some Discord groups about suicidal thoughts.
Wow.
And there's young kids in these groups.
Oh my gosh.
And they feel that when they have suicidal thoughts, instead of talking to their parents or a professional, the school nurse, whoever an adult in their life might be, they go to this group chat. And they don't know these people. Sometimes it's older people pretending that they're kids, and they give bad advice. And the kids say, well, I was talking to my group, and they told me to do this, so I did it. Meanwhile, if they talked to an adult in their life, they would have much more likely have more positive advice.
Right.
A lot of those kids are the kids that are having difficulty in school socially. So they run to something like a Discord group chat where they talk to these people for support, and they just don't get the support that they should have.
Interesting. So tell me about the urgent care center in Neptune.
Yes.
Okay.
So the urgent care center in Neptune, it's an urgent care regular urgent care for like medical illness, but we also have a portion of the urgent care dedicated to mental health.
Okay.
So we have a doctor, Dr. Eric Berger, who sees adults, and then I see children at the urgent care for mental health issues.
Okay. And what from?
So right now it's from age 5 and up.
Okay.
It's kind of a gray line. If you have a kid younger than that, we're able to see them. I would say if it's younger than that, maybe call ahead of time to let them know, because sometimes the staff there can be a little uneasy with the younger kids, but I'm perfectly comfortable with dealing with younger kids.
Okay.
We deal with many different issues there. I think the nice thing about urgent care is that it's urgent. You don't need an appointment. So if a kid's having a tough day and they're really struggling, you could bring them in. Well, we have a team of social workers there, nurses. They see the urgent care medical doctor as well as the psychiatrist, who would be me. And they're able to get some crisis therapy there. They're able to, if we need to come up with a more concrete plan, like follow-up, we're able to get them follow-up. Usually we can get them a follow-up appointment with a treating psychiatrist within 2 weeks. So while they're there, it's usually, an hour or two. They'll spend an hour with me, and usually maybe it's another hour before that, filling out the paperwork, talking to the other doctor, the nurse, and things like that.
Okay.
And we go over what's going on, what brought them there, how they're struggling, how we can help. A lot of the times it's support. They need guidance. The parents need guidance. The child needs guidance. We're able to start medications if it's needed, but it's not something that always happens. I would say probably less than half of the time we actually start medications there.
Okay.
But if they need it, it's no problem. We could start the medicine. The other aspect of what's nice about that is that we have a lot of connections through HMH, Hackensack Meridian, where we're able to send them to their appropriate outpatient follow-up. So if a child is using substances, we're able to send them to a substance use program, have them follow with a full team of social workers, substance use child psychiatrists, group therapy, individual therapy. Sometimes we get kids where they need a school clearance letter. Maybe there was a behavioral issue or a mental health issue at school, and the school wants them to be seen by a psychiatrist before they're allowed to go back to school.
Okay.
We're able to, we talk to the schools, we provide a school clearance letter. The nice thing also about the urgent care is sometimes in the past, when kids needed a school clearance letter, they might be waiting a week or 2 weeks to see a psychiatrist. They're able to come in the same day that the event happened at school. we talk to them, and if they're appropriate to go back to school, they can go back to school the next day.
I see.
If, let's say it's more of an acute situation where we're worried that the kid might harm themselves or somebody else, the emergency room is right across the street where we're able to get them the level of care that they might need.
Okay. So a lot to unpack
Yes.
within the urgent care. What are some signs, symptoms, perhaps your child, it's urgent, but what are some signs and symptoms that maybe kids are displaying of anxiety, of severe depression that you may not pick up initially, or, may not kind of really realize that your child needs, to get some mental
Sure.
help and evaluations?
So if we look at the numbers, they say around 20% of kids have some sort of mental health symptoms.
Okay.
The average delay in care can be up to 8 to 12 years.
Wow.
From when they initially have symptoms to when they get the care that they need.
Okay.
So it's tough to know exactly when that time is.
Mm-hmm.
A lot of parents say, it's something that will pass. A major depressive episode, a kid who's very depressed, without treatment, they could be depressed. Usually the average is 8 months before that depression goes.
Mm-hmm.
I think some of the things, to answer your question, to look at for kids, for anxiety, depression, ADHD, it's all kinds of different. So if we talk about depression, one of the big things would be isolation, where the kid isn't talking as much. They're not venting. They're not participating in the activities that they used to participate in.
Like grades have gone down or not?
Grades have gone down.
Okay.
Exactly. They don't want to go to soccer practice, or they don't want to go to like gymnastics, something like that.
Mm-hmm.
Where they might have enjoyed hanging out with their friends, maybe they don't want to hang out with their friends anymore.
Mm-hmm.
Sleep is generally an issue as well with depression and anxiety for different reasons. There's a lot of neuropsychiatric reasons for the sleep changes in depression, but what we see is with the depressed kids, sometimes they'll have trouble falling asleep. Other times, what we see is that they wake up early in the morning and they're unable to go back to sleep. And that's, a neuro symptom of depression.
Oh.
With anxiety, we see that the kids have trouble going to sleep because their mind's racing. They're thinking about the day, what's going to happen tomorrow. And there's all different types of anxiety, and we can get into that too.
Mm-hmm.
I think sometimes sleep is the first symptom that we see, the change in sleep.
Mm-hmm.
And then the change in sleep, it's kind of a cycle, because everybody that has kids knows when they're not sleeping, even if there is no psychiatric symptoms, their next day is not the same as when they're sleeping well.
Mm-hmm.
So what we see with depression is the depression is causing poor sleep. The poor sleep is causing worsening depression.
Oh.
So it's kind of an ugly cycle.
Okay. So is that kind of what you were saying earlier about like changing different environmental factors and like really kind of developing a plan to change like different behaviors throughout the day to then hopefully be able to treat?
Exactly.
Okay.
I think when you're starting to see those kinds of symptoms where your child's not wanting to do the things they once enjoyed, their grades aren't good, they're losing motivation to, do the things that they used to do, that's when it's time to kind of say something's not right here.
Mm-hmm.
Let's figure this out. And that doesn't always mean that you have to see a professional immediately.
Mm-hmm.
Excuse me. If you kind of nudge them in the right direction at first,
Mm-hmm.
I think that's the right thing to do. Making sure that they're keeping up with their things.
Yeah.
At the same time, sometimes they're just unable to.
Okay.
And when you feel like if you're pushing them to do...
Like in a routine or
exactly.
whatever.
When you're pushing them to do their routine and they're just really struggling,
Resistant, yeah.
you don't want to push too much where it gets worse.
Yeah, where they're like just overstimulated and not
Exactly.
helping themselves heal. Okay. What have suicide attempts increased in the last 2 decades?
Yes. So I think there's definitely an increase in prevalence of all mental health issues with children and adolescents.
Okay.
I think there's twofold to that. One being a general increase, and the other being increase in awareness. So parents are starting to understand what mental health looks like for children, and they're starting to seek help, quicker,
Okay.
which is good.
Yeah. I know a lot of kids deal with bullying. I think again it's become more prevalent, due to the downsides of social media. Do you recommend parents see a psychiatrist for that? Like, how would you, if your child is really down and you're in a scenario where they can't move and it hasn't really been helped. I know that happens a lot where like they go to the school and they're just kind of at their wit's end and their child is like really down. What do you recommend like in that situation?
So the first thing I recommend is what you had mentioned, going to the school. Sometimes the schools are overwhelmed with the issues that they're facing, and they might not have the resources to deal with it. Once you went down that route, it's unsuccessful. I think coming to see a professional is a great step. I think with these children, therapy would be a great option because a lot of these things are external factors. And if those external factors weren't there, maybe this kid wouldn't be feeling like that.
Yeah.
So we try and explain to the kid, just like the things we heard growing up. The bullying says more about the bully than it does about you.
Right.
Nobody ever understands that when they're a kid. But I think through, therapy over weeks and months, they start to realize, like, it's not me.
Yeah.
This is like, a jerk in school that is struggling with themselves, so they want to make me feel poorly. I've seen therapy work remarkably with those kids.
Interesting. Okay. That's helpful because, my heart goes out to the parents that have to, go through that with their child and obviously the child themselves too. But I know that it's increased and, you hear a lot about it, and especially with the schools and stuff. Anxiety. How is the anxiety defined, in children especially? How do you know that you don't have a child that just like kind of worries a lot and like what's the line there? What do a lot of people have anxiety? Is it something that can be completely like eliminated? Like how do I'm so curious about it because I have I get anxious about like certain things with work and just in general. I think it's like just kind of my nature.
Yes.
And I feel like probably my kids too to like a certain degree, but maybe they have more than I understand. So
Yes, that is an awesome question because the way I frame this to kids is that my job is not to take away your anxiety. And we do not want to take away your anxiety.
Right.
You're supposed to feel anxious if you have a test coming up or a big game coming up. If you didn't feel anxious in those times, then you wouldn't get the results that you want to get. So you need some level of anxiety. I always describe this to kids in maybe too much of a medical term, but I tell them there's physiologic anxiety and pathologic anxiety.
okay.
Physiologic anxiety is the normal anxieties that we have. You're running late to work and you're anxious because somebody might see you walking in late, or you have a math test coming up and you want to do well on the math test, so you feel anxious. And that anxiety sparks the motivation for you to prepare for that math test.
Okay.
So that's physiologic, good anxiety. The pathologic anxiety is when it starts to get too much. And there's different forms of that.
Okay.
So I think like a generalized anxiety, the child is constantly worried about their day. What is tomorrow going to be like? What is the next day going to be like? When I'm at school, is my mom okay? Is my dad okay? What's going to happen if I'm walking to the bathroom and I trip? Is somebody going to see that? They're just constantly worried about everything. And that's when it starts to lead to dysfunction in their daily life. If that anxiety about the math test led to them kind of bottling up in bed, unable to study,
Okay.
that's when we start to worry.
Right.
The other aspect of the anxiety that we see with children a lot is social anxiety or performance anxiety. They're worried about what their friends in school might think of them, or they're worried on the opposite end of the spectrum, worried about talking to people that they don't know because they don't know what to say. And again, there's a normal level of anxiety there, but if it's preventing them from hanging out with their friends when they want to hang out with their friends, or preventing them from doing a public speaking project at school, then that's something that should be treated. And the level of treatment is different for each kid, obviously. But that's kind of like where we draw the line when the anxiety starts to prevent them from doing things that they want to do or performing at a level that they are used to performing at.
Okay. That's interesting because, yes, if it's like debilitating where, you're letting fear like completely rule every aspect of your life, it's treatable. And is there medication that children go on for it?
Absolutely. So it's definitely treatable. For the milder forms of anxiety, I would say therapy is, for me, I always feel that environmental and therapy treatments are the best. And environmental might be, having a person in their life who is able to say, you're feeling really anxious right now, let's talk about it. And then that might be the mom, the dad, a school counselor, and they're able to kind of talk through it. Therapeutic modalities, there is a number of them. Sometimes a kid just wants supportive therapy where they come into the therapist's office and they just talk. They tell them about their day. They tell them about how their parents are too strict. Their teacher has too high of expectations, whatever the kid is worried about. There's other forms of therapy that are more formal, something like a cognitive behavioral therapy. And the cognitive behavioral therapy is great because the human brain is formed where we have this fight or flight response. The kids who are too anxious have this, a lot of the time, have a flight response, right? Where they bottle up and the anxiety is internal. Everything's driven inside and they're very worried about it. They form these things what we call automatic negative thoughts.
Okay.
So if mom calls them, they think, why am I in trouble? Rather than saying, oh, mom just wants to know what I want for dinner tonight. Their thoughts always go to the negative. If they have a test, I'm going to fail this test, rather than I'm going to study for this test and I'm going to do well on the test. Cognitive behavioral therapy works to kind of reorient their automatic thoughts to be less negative and more logical. So you take a step, you have an event, and you take a second to think about it. You think about where your brain went, right? So mom calls, you're in trouble, right? You take a step back and you say, mom called. Why would she be calling? Did I do something wrong? No, I didn't do something wrong, so I'm not in trouble. Maybe it's a good conversation that mom wants to have. Through this kind of conscious therapy with worksheets and they get homework worksheets that they can do with their parents or do by themselves depending on their age. Through that, their brain kind of rewires to think more logically about things before right away going to that negative. When therapy is ineffective or the anxiety or depression is too much for the kid to handle, there are a number of medication options. There's FDA medications approved for children, 7, 8 years old and up.
Wow.
Yes. And there's studies showing that the medications are even adequate in treatment of children younger than that.
Okay.
There's been kind of studies to say which one works best. Does therapy work best? Does medications work best? Or do both together work best? Depending on the level of symptoms, the studies have shown that for the longest duration of benefit, the two of them work best together. Therapy works as well,
right,
and medications work as well. They say therapy and medications, when you're at that level where you can use medications, therapy and medications work equally, they're equally beneficial. But when you put them both together, you see the quickest and longest lasting benefit.
Okay. The stigma of mental health, I think we've made great strides probably in the last decade or so with really, just more of an acceptance of adults seeing a therapist for no other good reason than to be, just better humans, right? And be much more, emotionally intelligent and just working on themselves. Do you find that is beneficial for middle schoolers, for high schoolers, just to kind of have someone to be able to talk to who isn't, they're high school guidance counselor, nothing against them or, the person within the school, but sometimes you don't always connect with that individual
Yes.
person.
So there's a couple of things here. First is I tell everybody, because I'll see adults too, therapy is good for everybody.
Right.
No matter who you are, no matter how well you're functioning, it's nice to have somebody to talk to. And somebody that's not in your life, somebody just to vent, then you walk out the door and you feel relieved.
You do. You feel later. Even when you
Yes.
say, just say it out loud. I think sometimes it's just.
And you learn things about you too. Like,
Right.
you learn things that you didn't know. And it's freeing in a way. It's nice. The part about like having somebody outside of school, I think that's great because schools, they have rules and regulations that they have to follow.
Right. So if you say something, yeah. it
Exactly.
might- Yeah. Okay.
So they have to protect themselves to some degree, which is understandable. They want to make sure everybody's safe. It's nice to have that outside kind of person. For some kids, their mom might be their therapist, and that's okay. But for much of the population, I would say therapy is great.
Right. Okay. Well, that's good to know. So it is an option and something that perhaps, moms should look into for their tweens and teens, because those years are just they're tough for
Yes.
for the kids. Let's talk about whether or not it's beneficial for if you have a child who you feel that the situation is urgent. What things to look out for that they're saying that maybe warrants a trip to the ER versus the urgent care, and how to navigate that.
So if we're facing like a urgent or emergent situation, usually the big one is suicide. We want to make sure that that doesn't happen, obviously. Sometimes kids are kind of what we call chronically suicidal, where they're depressed a long time, they're always having thoughts about not living, but there's no plan or intent. So that's the kind of three things that we look for: suicidal thoughts, plans, and intent. And I could go over each one of them. Suicidal thoughts can range from, I wouldn't mind walking down this sidewalk if a bus hit me and I died, to I want to kill myself by taking pills, right? Those are two very different things.
Okay.
The more passive suicidal ideations where they don't mind if they die is very concerning still, but they're not having thoughts of actually doing something to themselves. I think that's less of an emergent situation in a lot of times. If it's the first time you're hearing it, it's still an emergent situation. You want to get them evaluated as soon as possible. But when we start to hear kids say, life isn't worth living anymore, I feel hopeless, I'm helpless, nothing's working out, that's when I think it's time to bring them to an emergency room. Especially if they're voicing these plans, overdose, hanging, cutting, things like that.
Okay.
You want to bring them to an emergency room to make sure they're okay.
Got it.
It doesn't mean they have to be in the hospital,
Uh-huh.
but we have to make sure that they're being followed by somebody at that point.
Okay. And also, like, maybe explaining to the parents, things to also look out for,
Yes,
right? So,
yes.
Yeah.
So,
okay.
yeah, because parents, there's kind of two ends of the spectrum where there's parents that will say, oh, this always happens, it's not a big deal. And then the other parents who say, like, this is huge, we need to fix this now. And I think, there's a reason why the parents got to that point, whichever point they're at.
Yep.
But a frank conversation with a professional, with the kid and the parents involved, I think, is very important.
Right. To kind of work together as a team.
Exactly.
Okay.
And sometimes you have to tell the parents, like, listen, you got to lay off your kid. I've had that conversation with parents as well. A high schooler who's in 3 AP classes and is really struggling to pass the grades, and the parents are taking away the laptop, the phone. They can't go see their friends anymore. Like, your kid's struggling. Let's cut them a break here.
Right. Okay. Yeah, definitely. chill out. Everyone needs to chill out a little
Exactly,
bit,
yeah.
right? Right. Okay.
The goal is for
Yeah.
the kid to do well.
Yeah.
And
But the level of wellness doesn't have to be, A+
Exactly.
all the time. Yeah, I 1000% can relate to that. Okay. Let's talk about ADHD. We've talked a lot about ADHD on this podcast. I have a lot of experience with ADHD. My son had ADD, has ADD, but I've been through, he's now he'll be 21, so we're through high school and the years of the IEP and the, medicated, not medicated, and when you're faced with that as a parent the first time, and when your kid's not doing well in school, and every teacher every year keeps saying he's a great, it was like textbook. He's a great kid. Doesn't like to do his work. I always find him staring out the window. It was like this. They could have written it the same. It was the same
Yes.
email from the teacher every year, and I was like the parent that was. Like the commercial, the Huntington Learning, like I've tried tutors, I've tried this, or whatever, that I'm talking about. That was me. And I did, we tried everything. And then I think there was like a teacher that he had in 3rd grade, and her daughter also had ADD, which is, they don't say anymore. Now it's all just ADHD. And he just didn't have the hyperactivity like element of it. So she kind of said like, he's really displaying signs, and, so we had him evaluated and all of it. And I was so reluctant to medicate because I was just, like you said, the parent that's like kind of on one spectrum or the other, and not wanting to have, him on I just didn't like the idea. It didn't even really work for him. We tried like a lot of different things, and he just was, someone that like he did well if he was interested in it. But, when he wasn't, it was really hard for him to like even remotely focus on it. But, I will say that through those years, when you're kind of like really, really struggling and you're like, what is he going to do? Like, how is he even going to get through school? And I read books. I spent a lot of late nights. And now he's thriving. He's an adult, and he has his own place, and supports himself, and has I would say a great job, but a great job for his age, right? He's aspiring to be big things, and if you talked to me even 5 years ago, I would have been like, I don't know, like I don't know. And it's scary because teens are tough, and they like to really, really throw you for a loop, push the buttons for sure. But ADHD is, something that I could talk endlessly about, obviously. But what would you say for parents that are maybe in the early stages of working with this? Is there a reason to bring a child to urgent care for ADHD? And, like as a whole, is it, are we just seeing that more, did it always exist and now we're just diagnosed more prevalently because it's diagnosed properly? I'm just so interested about it.
Yes. So I could share a personal anecdote too. So I have a younger brother, and we grew up in Freehold.
Okay.
And he's 3 years younger than me. So my whole life I heard, you live vicariously through your brother, because he was a crazy man. He was always a good boy, right? But he was always getting into everything. And the elementary school he went to in Freehold, the principal told my parents, your son's butt cheeks are implanted on my couch, because he was in the principal's office so much.
Oh my gosh. Yes.
So, my brother was very much like your son, and now he's, grown, and he outgrew it too.
Okay.
The nice thing about ADHD is that many times it's outgrown. It's the most studied disorder or symptom cluster in child psychiatry.
Interesting. Okay.
They say around 5% of kids have symptoms that are consistent with ADHD. The thing with ADHD is it needs to be clinically diagnosed as ADHD. We see it in 2 settings. And it's important because it says a lot about the kid, right? If they're struggling at home, but then they're doing well in school and with their friends, then maybe it's something at home that needs to be adjusted.
Okay.
If they're struggling at school, but then you don't see these symptoms at home and they're okay with their friends, then maybe it's something at school that could be adjusted.
Right.
Right? Mm-hmm. But then when we see this in multiple settings, the kid's like hyperactive or inattentive in school and home or school and with friends, then it's likely something within the kid that maybe he's struggling to be in the environment that he's in. I tell parents all of the time, we have to adjust the kid's life a little bit. Sometimes a young child might have more energy than the average kid. And allowing them to release that energy at home in a structured way
Yeah.
will allow them to function elsewhere.
Okay.
So it doesn't mean we have to jump to medication right away. If we do some adjustments, like a 504 plan in school where they're able to just get out of the classroom for 5 minutes and just walk around, go to the nursing station, or leave class 5 minutes early. This way they can get to their next class in time because they get lost every time they're going to their next class.
Right.
The 504 plans help a lot.
Okay.
Fidget spinner, where they're able to kind of just get that sensory overload out and they're able to focus with it. Placement in the classroom. Maybe they need to be in the front of class because they need frequent redirection or away from another student who, they talk a lot with in class. Just those kinds of adjustments, I see improvements. When a kid continues to struggle and all of the adjustments have been made, the parents are using... with ADHD kids, I think parenting is a huge aspect of it because these kids are very tough. They want to listen, but they can't listen. But they're trying so hard, so it gets so frustrating for everybody. The mom and the dad are frustrated, the teacher's frustrated, the kid is frustrated. Using what we call positive reinforcements, I think, for these kids is what's most helpful. And sometimes that could be as simple as a calendar where if the kid acts or does the chores or does what he needs to do, he gets a star. If he gets a certain number of stars per week or per month, then he gets some type of prize. We see kids, when they have this concrete thing that they're working for, they're able to go to the kitchen, look at the fridge, and see how many stars they have on the calendar that month.
Okay.
And it really puts that kind of drive. When they continue to struggle, this is when we start to think about medications. The medication treatments for ADHD are the most effective medications that we have in all of psychiatry.
Okay.
It's nice because they work right away.
Yeah.
Or they don't work. And then we know, and we change it. We make adjustments. Less than half of the children who require medication treatments for ADHD will continue to require the medications when they're older.
Okay.
A lot of the times we see the hyperactivity really being the symptom that affects their daily functioning. The hyperactivity will come down through their teenage years when their brains are still developing.
Right.
And then they don't need the medications anymore.
Okay.
But with medication treatments for ADHD kids who are unable to function, we see a decrease in car accidents. We see an increase in grades and further education, going to college or tech school, whatever they want to do. They have less substance use issues. They have less rates of being arrested or getting into physical altercations. So the medication treatments are truly effective for ADHD. But like I said, it's kind of, you want to make sure that they need the medications before you put them on medications.
Right.
Your question regarding, do we start the medications in the urgent care? We do, yes. I'm kind of more on the conservative side personally with medications. I think we should give the kid a fair shot before we medicate them because there's risks with any medication. If a kid comes in, they're completely, their life is kind of a mess and they're not able to function, they're missing school because they can't sit still, we'll start the medications for those kids. I think far more often what we'll do is have the parents fill out what we call a Vanderbilt form. It's a checklist for the parents and the teacher to fill out.
Okay.
Then I have them follow up with a treating child psychiatrist who they'll follow with. the goal is for them to have that form filled out before they see their next doctor. So they come to the next doctor, they have this objective information with the subjective reports from the parents and the teacher, and they're able to start the medication and then follow the child. So they see them when they're completely dysregulated off of medications, and then follow them for however long they need to follow them for, and have them fill out that checklist regularly to see if it's helping with the symptoms in school and at home.
Interesting. Okay. So it's not necessarily always that the child is failing. They can be, prescribed medication if there's just like an additional kind of factors, right? And I read this book one time. It's called He's Not Lazy. I forgot the author, and it was kind of like 4 different factors. It was about boys, raising boys, about why kids don't achieve. And, it's not necessarily always that they're not doing well in school, but it could just be that they like really, maybe they are performing, but they're really struggling to perform, right? So like the medication then makes it, it's more, clear, right?
Exactly.
To be able to think and not have to maybe spend 3 hours studying when it could take them 1, right?
Exactly, yes.
Yeah.
I think it's important to know what a child's baseline is.
Yeah.
So if a kid is usually a straight A student, but then, these symptoms start to arise as they get a little older, that's different than a child who might not be a straight A student who's then, continuing to be at that level.
Yeah.
So it's it kind of depends on each child, definitely.
Right.
There's some kids who are able to perform at that straight A level, but need hours and hours of studying or redirection, like you said. It doesn't mean that they don't need medication treatment.
Okay. We talked about a lot of different things today. The, key takeaways for me really is that there is this incredible resource in our backyard where moms, can bookmark and know that if they have a child that's struggling with a multitude of different things, and their mental health, that we do have, a place to go with Hackensack, and that you're providing, an incredible resource for us to be able to, get answers for our children, because it's tough. There's a lot happening right now, even within our community. There's a new organization that was recently developed called the Balance Project, about just providing awareness for parents about what is lurking within the internet and social media for our kids, and really kind of, I think, limiting like what the kids are given access to, and just providing awareness. I've talked a lot about what can happen on this podcast, and just really being wary about what kids are given access to, and being you don't want to be that helicopter parent, but at the same time, like once, like you said, the cut court, what's it called, the group that the kids are in.
Discord.
Discord, thank you.
Yes,
Saying the cut
yes,
cord.
yes.
Discord. I didn't know that, right? So just really like talking and providing like much more awareness. So I'd love to have you back on to talk about, just all kinds of different things that are related
Definitely.
to that in particular. But in the meantime, where can moms find you? And, who should they call if they're just going through something rough?
So there is a big team of child psychiatrists at Jersey Shore and through the Hackensack Meridian Health Network. I think I wouldn't hesitate to come. You're not wasting anybody's time. You're not wasting the doctor's time. The parents wouldn't be wasting their time or the child's time. I think if you feel that there's a need, just bring them. We're not, pill pushers. Just because you bring the kid in doesn't mean that we're going to force them to come back and be on medications.
And walk around like a zombie.
Exactly.
Yeah.
That's my biggest thing, is that we want the kids to feel normal. If they're taking medications, we want them to feel sad when bad things happen. We want them to feel happy when good things happen. And maybe you come in, you talk to us, and everything's good. And we just provide the resources, maybe community resources or therapy resources. There's never too small of an issue just to get a checkup on. Just the same way you would go to your pediatrician.
Right.
So personally, I'm at the urgent care where anybody can come and see me at any time. I also see patients in crisis and consults at Jersey Shore.
Okay.
We have a full team of outpatient child psychiatrists who have regular openings. We could schedule kids within, a couple of weeks. Hackensack and New Jersey have also developed a program called the PPC, which is the Pediatric Psychiatric Collaborative.
Okay.
The goal of the PPC is to help pediatricians manage medications or kids with psychiatric or psychologic symptoms that might not need the level of a psychiatry. They kind of do like consults with the pediatricians. If the kid's on medications and they need adjustments, the pediatrician is able to call us and see, like, should I go up? How much should I go up by? Which is a really nice aspect. So if there's something going on, you're not sure if you need to see a psychiatrist, you can always mention it to your pediatrician, and the pediatrician can either reach out to the PPC, they could reach out to us at Jersey Shore or any of the Hackensack hospitals and come up with a plan.
Okay.
Yeah.
That's great. Yeah, I love that. Hackensack really makes it, easy because there is so many different resources within the network, and it's really a great way to connect and find the best care for your child. So we will link everything that we talked about, where to see you and the entire department in the notes here. And feel free to reach out with any questions. And then, hopefully we'll have you back on and we'll talk a little bit more about it, because it's really important topics today. I tried to make sure we covered it as much as we could about what, about what parents are facing, because it's a lot, and it sucks, but it's important. And we want to make sure that our kids are happy and healthy. So thank you.
Thank you. It was a pleasure.